Thank you, Dr. Hasted. What a terrific president you are. A round of applause for our president. Graduates, mothers and fathers, other student sponsors, esteemed faculty, ladies and gentlemen, congratulations, graduates. You've made it so far. It was about 42 years ago today, or now, that my mother and father dropped me off here at Carroll University, at that time, Carroll College. That was a blessing in my life, but even a greater blessing is that my mother and father are actually here today. So I would like them to stand. 65 years of marriage. And so they don't feel lonely, all mothers and fathers who dropped their students off 4, maybe 5 years ago today, please stand so we can honor you. Come on, stand. You earned it. Thank you, moms and dads. It's great to have you all here today to celebrate this really special, wonderful graduation day. I've titled today's very brief remarks, The Ginkgo, subtitled Lessons Learned Here at Carroll University and Beyond. My first academic memory on this campus was at the end of the first week, the day of my first exam in Biology 101, taught by Dr. Roy Christoph. I hear some groans down here. He was the one tough but fair professor, and I think we all felt a bit intimidated. Like most of the graduates here today, I asked myself, did I have the right stuff? The exam seemed simple enough. It was a nature tour identifying trees in this courtyard by their leaves. I studied like a dog. I knew the leaves, the stems, the branches, the phloem, the xylem, the rings, the genus, the species, the subspecies. I was ready. The next morning, Dr. Christoph took us on this nice walk. He introduced us to the first tree we were to identify by its leaves. I froze. I had no idea what that leaf was. It wasn't any one of the leaves or trees that I had studied. I got to the first question on the first test in Biology 101, and I didn't know the answer. I was already a failure in my first week at college. My career in medicine was finished before it even got started. What would I tell my mother and father as they were driving me home after only a week of college? A failure. I'm sure that went through your minds too. Well, son, you have a lot to learn, Dr. Christoph said in a somewhat kindly manner. That leaf and tree that you missed is the ginkgo. It's the world's oldest tree. I thought we should start with the oldest. It was around at the time of the dinosaurs during the Jurassic Age, 270 million years ago, a fact I've never forgotten. Ginkgo lesson number 1, he said, is be prepared for the unexpected. It's the principles and the process of thinking, not just the facts. You could have deduced it if you actually took some time to look at the leaf because it has more than 4 veins per segment. It's a ginkgo. You panicked. Next time, think. It's the principles and the process, not the facts. It's ginkgo think. I felt the failure that day, but I never forgot that leaf and tree and the principles and process of thinking, ginkgo think. That's why I've given each graduate today a special leaf so that you remember ginkgo think. I hope it serves you well. The next 4 years on this campus flew by, teaching by many great professors, including Dr. Ted Michaud, who's out there somewhere that I had the pleasure of seeing this morning. I met many wonderful people as you have, and fellow students, including my dear wife of 38 years. I worked like crazy and learned many ginkgo lessons. But like it is for you today, it was now time for me to move on. Because of Drs. Michaud and Christoph, McIntyre and Bayer, and others, they encouraged me to stretch myself, like the faculty I'm sure has done for you. So stretch yourself. I got into medical school at Columbia University, New York City, and even more remarkable is at that time I was presented by a letter from an anonymous benefactor who said they would pay for the first 3 years of medical school on one condition, that someday I would pay for all the medical school costs of a future medical student when I was able. Strangely enough, that letter was on stationery with ginkgo leaf imprint. Ginkgo lesson number 2. If you had help to get here, and all of us have, make it a habit to remember this very special graduation day. Remember your struggles, and when you're able, give monetary support to this university and to the students who follow you, and ask them to do the same. If we all did that, we'd never really have to worry about keeping this wonderful university here for the next many generations we hope will follow. The first years at medical school at Columbia were brutal. I worried that the science and the writing and teaching that I had learned here on this campus might not be good enough compared to what my fellow students were from Yale and Harvard, Swarthmore, Stanford, MIT. But I was wrong again, because I had been prepared to think. I had been prepared for the unexpected. I had ginkgo think. I learned many important lessons at Columbia, working with pioneers in medicine, including Nobel laureates, the first cardiac catheterization, the discovery of the anti-seizure medication Dilantin, discovery of a virus that causes cancer, 4 base pairs composed DNA, and other incredible things. There were many special experiences, but one stands out as ginkgo lesson number 3. I was on a pediatric rotation with a distinguished physician of the time, really a giant pediatric oncologist by the name of Dr. James Wolfe. We were asked to see a 3-year-old little girl with a big cancer growing out of her skull. It was really the size of a baseball. She was comatose, having jerking seizures. Her parents were in a room, crying quietly in despair. As we walked in, several nurses, social worker, and an ethicist asked us, "Why are you here? That little girl doesn't need you, and she certainly doesn't need any treatment. She needs to be left alone to die. It's a hopeless situation." "The parents have called us," Dr. Wolfe replied. "We're here because the parents have asked us to be here." We pulled a curtain around the tiny, lifeless body, seizing child, to examine her, and imprinted on that curtain was the ginkgo leaf. As we talked with the parents were clear. Do anything you can, anything to help our daughter, even if it's for a short period of time. Dr. Wolfe turned to me, the student, and said, "Well, Dan, what should we do? Treat this child and be ready for the criticism, which will surely follow, or do nothing?" I looked up and saw the ginkgo leaf on that leaf again. It seemed to me that the principle was to listen to the parents who love this child. The answer was treat. Dr. Wolfe wrote the order for the new chemotherapy called daunorubicin. Some people in the audience here that I know are alive because of this drug today. The hospital staff fought him every step of the way. Committees met, lawsuits were threatened, nurses refused to give it, so we gave it ourselves. That's what the mom and dad who loved this child wanted to do, and that's what we did. 3 days later, like a miracle, the tumor had dramatically decreased in size. The child was up running around, alert and loving. "Great idea to treat the child," all the nurses and the rest of the hospital staff said. "We certainly did the right thing, didn't we?" Ginkgo lesson number 3. The ethics always demand that you listen to what the individual person wants and be guided by them, not what others think they should have. Or if a person can't speak for themselves, listen to the people who love that individual. You will never get it wrong. Solomon saw who didn't want the baby cut in half. Over the years, I've been privileged to care for so many wonderful people, to give some new anti-cancer agents, some that didn't work, and thankfully some that did. Recently, though, our science has improved so much, there are more and more effective therapies with fewer and fewer side effects. There has been a decrease in the absolute number of cancer deaths in this country over the last 4 years. This is because of early detection and improved treatment. At present, 1 in 20 Americans right in this audience are cancer survivors. Cancer is at least 200 different diseases, and that's why it's such a tough adversary. But there are at least 30 of these 200 types of cancer that can be totally cured. And overall, 68% of all patients, regardless of their stage, can be cured. 4 times better than when we left this campus in 1969. Progress will continue to be made, but it's not fast enough for any of us. Graduates, I believe you will see all types of cancer cured in your lifetime. I have cared for many patients with all types of illnesses, helped many, and lost many, including one early this morning. I have seen just about everything: pain, suffering, courage, hope, hopelessness, caring, altruism, triumph. I have seen people in Haight-Ashbury with drug overdoses injecting turpentine in their arms, jumpers off the Golden Gate Bridge, some who survived, many who didn't. I've even seen a mother of 18, on Mother's Day I remember this, who named her newborn baby number 19 that I delivered after me, Daniela, because she was a newborn baby girl. All of these experiences, starting from this small liberal arts school in the Midwest called Carroll University. Graduates, who knows what your experiences will be? Patients have taught me how to live, and patients have taught me how to die. And they have taught me the last Ginkgo lesson number 4, which is that you must concentrate on each individual person you meet, identify with them, and try to help them in any way that you can. A recent patient, Mrs. L., a delightful 78-year-old woman, came to see us with the following request. Dr. von Hoff, I've tried every treatment possible against my cancer. Can you biopsy it, run some tests, and see if there's anything at all that'll work for me? I just want to make sure I'm not missing anything. I know I'm near the end. Mrs. L wanted the new approach, precision personalized medicine. We biopsied Mrs. L tumor and profiled it in detail with the best science we had, but we could not find a target or a therapy for which would help her cancer. I had to deliver that disheartening news, but I told her what we could do is offer the best possible personalized pain and symptom control. And that helped her a lot. Our patients and their families constantly teach us that digging deep and trying to help in any way we possibly can is so important to them. Now here's a letter we received from Mrs. L's daughter on ginkgo leaf imprinted stationery. To everyone at TGen, thank you so much for all you did to try and help my mother. She felt so grateful to have known you all, and so sad that her illness progressed so far that there was no new therapy that could help her against her cancer. But while she was with you, she felt so cared for and coddled. It was a wonderful experience. My mother passed away peacefully in my arms and spent her last few days surrounded by her family in her own home. We all laughed, cried, prayed, reminisced, and loved each other. It was a special time. Thank you again on behalf of my father and all our family. Ginkgo lesson number 4. It's important to try. It's about curing, but it's also about caring for the autistic child, the elder, for the suffering. An anonymous writer put it best: to cure sometimes, to relieve often, to comfort always. Graduates, the Ginkgo lessons, please remember. Number 1, Ginkgo think. It's the principles and the thinking process. Ginkgo 2, give back. Ginkgo 3, listen to what the individual wants. Ginkgo 4, try to personally help each and every person. I've gotten quite a few things wrong in my life. There have been a lot of Ginkgo lessons. But in the very beginning, I got one thing right, like you did. I went to Carroll University. And one more thing. A few days ago, my mother and dad gave me a birthday card for my 64th birthday. And you guessed it, there was a ginkgo leaf on the card. That card was sent with a great deal of love and many wonderful memories like we have here today. But based on what I've told you today, the message was clear. Son, you still got a lot to learn. Congratulations, graduates. Now you're ready for anything unexpected because you have Ginkgo Think. Thank you.